understanding the distinctions between adverse effects, adverse drug reactions, and adverse events is crucial in the field of pharmacology and clinical medicine. An adverse effect is any undesirable or unintended consequence of a drug when it is administered in the normal dosages necessary for therapeutic effects. These effects are typically predictable based on the pharmacological properties of the drug and can range from mild to severe. For instance, nausea can be an adverse effect of many chemotherapy drugs, understood as a direct consequence of the drug's action on the body. An adverse drug reaction is defined as any noxious change suspected to be due to a drug, occurring at doses normally used in humans, requiring treatment or a decrease in dose, or indicating caution in future use of the same drug. ADRs may be predictable, type A reactions, or unpredictable, type B reactions. Type A reactions are dose-dependent and related to the drug's known pharmacologic actions, like anticoagulant drugs causing excessive bleeding. Type B reactions are not dose-dependent and include idiosyncratic reactions or drug allergies, which are not predicted by the drug's pharmacological action. For example, Captopril is an angiotensin-converting enzyme, that is ACE, inhibitor. This enzyme converts angiotensin-1 to angiotensin-2, which acts on AT1 receptors to increase blood pressure. The mechanism of action of captopril is to inhibit this enzyme, thereby blocking the conversion of angiotensin-1 to angiotensin-2. Consequently, its pharmacological action is to decrease blood pressure, which can produce hypotension. However, it also inhibits the degradation of bradykinin, leading to increased bradykinin levels in the body, which can produce adverse effects such as dry cough. In such cases, the dry cough induced after the administration of captopril is suspected to be due to the drug, even at a therapeutic dose. In such cases, the ACE inhibitor is often replaced by another group of drugs, such as angiotensin receptor blockers, ARBs. An adverse drug event is any untoward medical occurrence that may present during treatment but does not necessarily have a causal relationship with the treatment. Suppose a patient with a history of convulsions missed a dose of their anticonvulsant medication, which led to a convulsive episode. This, in turn, resulted in the patient falling from the bed and sustaining a head injury. In this case, the head injury is classified as an adverse drug event. The head injury itself is not a direct effect of the anticonvulsant drug, rather, it is a consequence of the seizure that occurred due to missing a dose of the medication, thus considered an adverse drug event. In clinical practice, these distinctions help healthcare professionals understand the nature and root cause of the negative outcomes associated with drug therapy, which in turn guides the strategies for prevention and management. This differentiation is also essential for pharmacovigilance activities, helping to monitor, assess, and improve the safety of drugs. Thank you.